Thanks very much, and thanks to my co-author, Joe Hale, who was a great collaborator on this paper. So this is a great follow-up to the last session because I'm basically talking about the intergenerational transmission of poverty as well. However, I'm focusing on this specific group, which is unauthorized children and children of unauthorized parents or children in mixed status families. And by unauthorized, I refer to children who are immigrants and do not have legal status to live in the United States, either by virtue of entering without inspection or because they came in with a legal visa and then overstayed its expiration date. And as we heard in the Supreme Court arguments earlier this week, this includes children who've been approved for the Federal Deferred Action Program, DACA, which grants temporary relief from deportation and work authorization on childhood arrivals, but does not grant legal status. Mixed status families refer to families where at least one member is unauthorized. In this presentation, I'm going to focus on children who are U.S. born and their parents are themselves unauthorized. And of course, by unauthorized, we also commonly say undocumented. I'll say unauthorized for this talk. So the study of these populations is important, first because of their size. Unauthorized children make up 1.5% of all U.S. children, and U.S. born children of unauthorized immigrants are 5.4% population of children in the United States. U.S. born children of unauthorized immigrant parents are a larger percentage of young children, about 8% of children under 6. And unauthorized children are more commonly represented among older children, among adolescents aged 12 to 14, where they're 2.4% of that population. Together, children lacking legal status make up about a third of all children of immigrants. And U.S. born children of unauthorized parents are 7% of K-12 students in the United States and 13% of K-12 students in California. These numbers reflect substantial growth in these populations over the past 2 decades, particularly in the population of U.S. born children of unauthorized immigrants, which grew from 1.2 million in 1995 to 4.5 million in 2012. And this growth mostly mirrors growth in the unauthorized immigrant population, although the ratio between the two has increased, suggesting that the unauthorized are more likely to have children in the United States today than they were 15 to 20 years ago. And the fact that more children are living in the United States with their unauthorized parents suggests that these families are largely here to stay, as sociological research on migrant settlement shows that the birth of children in the United States tends to indicate permanent settlement of the family. The study of this large and largely settled population is also important because of its vulnerability. Children of unauthorized parents, which includes both the U.S. born and unauthorized children themselves, who typically have unauthorized parents, are twice as likely as natives or children of authorized parents to live in poverty. So the most recent data we have is from 2009, when 1/3 of children of unauthorized parents were under the federal poverty line, compared to 17% of children of natives in that year. So for children of immigrants, this reflects the impact of traditional risk factors for poverty, which includes parents' low levels of education and English language ability, concentration in disadvantaged communities with limited access to quality schooling, and exposure to racism and discrimination. But for unauthorized children and children in mixed status families, the elevated poverty rate also reflects the fact that immigration and other policies reduce earnings, separate families, threaten health and well-being, and restrict access to healthcare, social services, and higher education. So I'll talk about research on each of these 4 areas of social life in turn, and then conclude with some questions for future research. So children in mixed status families are increased risk of poverty in part because their parents are concentrated in poorly paid jobs, particularly in agriculture, domestic work, landscaping, construction, and the restaurant industry. But among immigrants within this sector, the unauthorized are disadvantaged. So research shows that they earn lower wages, experience slower wage growth, lower returns to education, and are exposed to greater hazards than their authorized counterparts. And this is in models that control for various observed characteristics and differences between groups, such as English language ability, education, and work experience. So this may suggest that the unauthorized are disadvantaged as a result of forces that have nothing to do with their human capital. So because employers pass off the costs of hiring the undocumented onto the wages of workers, or because the unauthorized are unwilling to file complaints, labor complaints against their employers for fear of being turned into immigration authorities. A different way of looking at this in the research is to examine how the wages and employment experiences of immigrants change following the legalization. And studies of the 1986 Immigration Reform and Control Act find that the amnesty improved work outcomes of those who received the legalization. So they experienced increased wages, labor force participation, and they were also more likely to find jobs that matched their skills. Okay, so as we just heard, family structure is important for children's well-being. And in fact, immigrants on average tend to, or children of immigrants are more likely to live in intact families than children of natives. So families, the immigrant families are considered a bulwark against the risks that come with immigration. But for the unauthorized, immigration policy separates families as a result of several mechanisms you're familiar with. First and most directly, unauthorized parents and children are at risk of deportation. So I'm sure you know deportations increased steadily since the early 1990s, when approximately 50,000 immigrants were deported per year, to a high of more than 400,000 deportations in 2012. There's been a recent decline. So last year, 238,000 immigrants were deported. In the wake of two laws passed in 1996, judicial discretion was severely constrained in deportation hearings, meaning that judges could no longer consider the best interests of U.S. citizen children or other family members in most cases. So between July 2010 and September 2012, 90,000 parents claiming a U.S. citizen child were deported each year. And studies find that the majority of children who are separated from their parents as a result of deportation remain in the United States. Some children are permanently separated from their parents as a result of deportation. So in 2011, an estimated 5,100 children of deported parents were in the child welfare system. A second mechanism of family separation are the long waiting lists for adjustment of status to permanent residency for getting an immigrant visa. Immigrant visas are classified by priority, and they're subject to an annual per-country quota of 7% of the total number of visas that are issued each year. And this, of course, produces long wait lists for lower priority visas from high immigrant sending countries, such as Mexico. So according to recent estimates, as many as 3.5 million people legally qualifying for a U.S. visa are waiting for their priority date to come up. And for some, the wait can be as long as 21 years. Some families qualifying for visas, of course, choose to reunite with some members in unauthorized status in the United States rather than wait for the visa. So one study estimated that 14% of the unauthorized population living in the United States in 2005 had been approved for legal permanent residence. There's a high cost to this strategy. Living in the United States in unauthorized status for 6 months imposes a 3-year bar on adjustment of status, and residing in the United States for a year or longer imposes a 10-year bar. So in other words, these waiting lists contributes both to family separation as well as to the formation of mixed status families. Unauthorized migrants often leave behind children and spouses in their country of origin in order to avoid exposing them to the perils of crossing the border, living in the United States in unauthorized status. And these so-called transnational families are really quite common, particularly among Latino immigrants. By one estimate, as many as 9% of Mexican children will experience their father's migration by age 14. Some portion of these children will reunite with their parents north of the border in unauthorized status in order to bring an end to long separations, which of course adds to the number of unauthorized children, as well as to, in other cases, unauthorized parents will have children in the United States, which of course contributes to mixed status families. As with families, immigrants tend to be quite healthy on average. However, research shows that unauthorized children and the children of unauthorized parents have worse health and development outcomes than their authorized counterparts and counterparts of authorized parents, even net of socioeconomic differences between the authorized and unauthorized. This health impact likely arises from a variety of sources, but developmental research emphasizes the fear, stress, and stigma of being unauthorized, which children become increasingly aware of as they grow up. So as children grow up, awareness of the implications of unauthorized status translates to an experience of what scholars call internal liminality, which means that you're stuck indefinitely in this in-between position where your social identity as an immigrant or as an American is not recognized by the society around you. And as children become aware of the hostile and disparaging mass media portrayal of unauthorized immigrants, as well as the more common stigma associated with being unauthorized, their identities, feelings of self-worth, and friendships are compromised. Exclusion from mainstream rites of passage into adulthood, things like getting a driver's license, or getting a first job, or getting financial aid to attend college, leads many young unauthorized immigrants to feel hopeless and isolated, and of course these experiences negatively impact mental and physical health. And as we discuss next, health may also be compromised by restricted access to health care. So this vulnerable population is largely excluded from public health insurance and from federally funded services, including food stamps and cash assistance. Unauthorized individuals are ineligible for Medicaid, Medicare, and for subsidies provided to low-income households to purchase insurance on the exchanges established by the ACA. However, states may use their own funds to provide services to the unauthorized. And as we heard the Be this week, California just announced a major expansion of Medi-Cal to unauthorized children, which means that California joins 4 other states in DC in doing so. Unauthorized migrants can make use of emergency room services, food packages, and other services through the WIC program, and prenatal care funded by the Children's Health Insurance Program through the Unborn Child Clause that's been adopted in 17 states and DC, and includes California. So studies examine the impact of the variation in these policies in order to reveal their consequences, and of course find that they matter importantly for children. For example, low-income, foreign-born Latina single mothers in states that passed the unborn child ruling, the CHIP expansion, experienced greater increases in their prenatal care usage than in states that did not. We also know from studies that the unauthorized simply have restricted access to health care. So in California, for example, unauthorized adults are significantly less likely to be insured, to have a usual place of care, to have seen a doctor in the past year, or to have gone to the emergency room than their authorized counterparts. And again, this is controlling for observed differences between groups. Now, U.S. citizen children are eligible for these services, even if their parents are unauthorized, but they underuse them for several reasons. Studies suggest that unauthorized parents are fearful of accessing services, even when they or their children are eligible. This came up earlier in a question. This fear is based in several policies passed in 1996 that sought to reduce the social service usage of immigrants, including a public charge provision which provides for the denial of an application for lawful permanent residence if immigration officials determine that the applicant is likely to become a public charge. A second is a visa law provision requiring that sponsors for family-based visas file affidavits of support, promising to maintain the sponsored immigrant at 125% of the federal poverty line level, and to repay any means-tested public benefits the immigrant may receive. And finally, there's a reporting provision requiring agencies administering SSI, public housing, and TANF to report to the DHS persons who the agency determines are not lawfully present in the United States. So these rules are actually rarely enforced, but many immigrants believe that if they receive services that their children are eligible for, they may jeopardize their or their family members' ability to adjust status in the future, that it's going to result in economic burdens for their visa sponsors, or that it will result in deportation. A final area we talk about in the paper is education. Unauthorized children are guaranteed access to K-12 schooling through the Supreme Court decision in Plyer versus Doe in 1982. But there's disadvantages that these children face within this system, and they're reflected in studies of achievement. Some of this disadvantage results from the same sources of disadvantage facing other children of immigrants in general, including parents' low levels of human capital, limited English language ability, familiarity with the U.S. schooling system, few economic resources to dedicate to education, residential concentration in areas with low quality schooling, and residential mobility. But children of unauthorized parents may be additionally at risk as a result of the disadvantages their unauthorized parents face in the labor market. One study found that, because they're reluctant to engage with school authorities for fear of revealing their status. So one study found that adult Mexican-American children of unauthorized immigrants attained 1.2 fewer years of education on average than Mexican-American adults whose parents had adjusted status. This is controlling for both measured and unmeasured differences. The consequences of being unauthorized become manifold at the transition from K-12 to post-secondary schooling, because there are no federal protections for access to higher education, and there's significant state variation in these policies, which studies have found do affect college enrollment and graduation. There's also studies of amnesties like the one I described earlier, which find that the legalization increases the likelihood of college enrollment among young adult immigrants who benefit from the amnesty. So to wrap up, the research on this large and vulnerable population suggests that as far as child and family poverty are concerned, federal and state policy are deeply implicated, but I think we can do a lot more. And our central recommendation for future research is to invest in more and better data on immigrant legal status, which came up in a question earlier today. This is particularly in national data sets. Most of the studies that I've described today rely on convenience samples, qualitative and ethnographic approaches in order to establish trust with the community. Most state and national data do not include detailed questions about legal status because of presumed chilling effects on participation. There's a few exceptions, including the Survey of Income and Program Participation and the California Health Interview Survey. And we have some studies that show that response rates and attrition in these surveys are no different from other surveys, suggesting that the questions are not intimidating after all, so I think we can do more. Incorporating these questions would allow us to address a number of key research questions, including documenting and assessing impacts of family structure on unauthorized immigrants, just knowing how long families are separated, what their transnational families look like, and how those structures affect developmental and health outcomes of children. A second area of research involves identifying the mechanisms that link disadvantage, or that link unauthorized status to health and educational disadvantages. So is it economic disadvantage, stigma, stress, family separation? More research should exploit state and temporal variation in policy context to better identify policy effects on various outcomes. To do this kind of work, we need data on the unauthorized from multiple time points and places. And finally, we don't yet understand to what extent national origin differences in assimilation and incorporation reflect the disadvantages of legal status. So a key question in the immigrant assimilation literature is why certain groups, particularly Mexican American and Central American immigrants, do not experience substantial upward mobility across generations. And the hypothesis is that this reflects the effect of legal status rather than national origin. So we need more research on this in order to tease out that hypothesis. So thank you very much.